The question is, if we have a patient with early stage lung cancer who you have treated with surgical resection and they are potentially cured from the surgery, we know that adjuvant chemotherapy helps a big subset of patients who have had surgery, and the decision to use adjuvant chemotherapy depends on whether lymph nodes are involved, how big the tumor is, and any other potential risk factors. In the advent of molecular therapies, in the era of molecular therapies, one key question is, how do we use molecularly targeted drugs in early stage disease? For instance, erlotinib is approved for metastatic lung cancer patients who have EGFR mutation. Crizotinib is approved for metastatic lung cancer patients who have ALK gene rearrangement. How do these drugs play into the treatment of early stage disease? And that's what the Alchemist program is meant to help understand. So the Alchemist trial is actually a combination of three main components. The first component will be to test patients with early stage lung cancer after surgery to see what kind of molecular abnormalities they have in their tumor. The second component is for patients with an EGFR mutation, they will then be offered the trial that would compare erlotinib to placebo after they have had the standard adjuvant chemotherapy. The third component is the ALK patients, where they would be randomized to crizotinib or placebo after they've had appropriate standard adjuvant therapies. We also have larger ambitions for this program in that not only do we want to know how erlotinib or crizotinib will help these patients, but also from all the patients who are screened for these molecular abnormalities, what biological information, what can we learn from their genotype, what can we learn from their tumor and their genomics to see if we can down the road make projections for patients with lung cancer at large. So use this information in a much larger manner than what we can if we just did one particular trial. That's the overall goal of the Alchemist program. I'm happy to say that we're just about a few weeks from launching Alchemist. This is a very concerted effort from the NCI, from the Eastern Cooperative Oncology Group, the Alliance Cooperative Group, and other cooperative groups that have been working with us in development of these projects. Our goal is to have nearly 8,000 patients with early stage lung cancer enter this program, have their tumor tissues tested. If they have a molecular abnormality, they will be randomized to one of these trials. If they do not have a molecular abnormality, they will still get the standard therapy, but we will be able to learn a lot from the genomic information from their tumors. And when we talk about genomic information in this program, we're going to be doing very detailed sequencing of the tumor genome so that even things that you cannot make sense out of in smaller groups of patients, the power of the higher number of patients will help us understand the impact of that. So that's the goal of the Alchemist program. The clinical trials will be available, and we understand and recognize that at this point, the use of targeted agents in early stage disease is still at an experimental phase. This is not something we would recommend to somebody to go and take crizotinib or erlotinib or afatinib if their physician finds out that they have mutation.